Welcome to Jasiri. Today on Jasiri, one viral workplace moment has opened up a much bigger conversation about a generation changing the rules of work. It started with the words, "Good morning, Tony." A young graduate trainee addressing UBA group chairman Tony Elumelu by his first name triggered, a correction, a viral video and a fierce debate over respect, hierarchy, and workplace culture. But perhaps the bigger question is not simply whether she should have said Tony. Perhaps it is the what happens when Gen Zs enters the workplace built around roles they are no longer, automatically going to accept. This is a generation that has been told to speak up, challenge ideas, ask questions, prioritize well-being, demand flexibility, and see the workplace as less hierarchical. But many of the people managing them were raised, professionally on different values, seriously different titles, loyalties, and about knowing your place. So when the work collides, is Gen Z being disrespectful or just different? Honestly, I'm struggling to read my script because I feel it's so small. We have an expert standing by to help us unpack, some of this. But first,
a diphtheria outbreak in Reno local government area of Kano State has raised serious concerns, with at least 50 people reportedly dead and several others hospitalized. Now, the outbreak is said to be particularly severe in Ritin and Sabwarkwara communities, as residents face the growing threat of the highly contagious disease. The Kano State House of Assembly has now called for urgent intervention, directing its health committee to engage with the Ministry of Health and ensure emergency support reaches the affected communities. Now, to get a clearer picture of the situation on the ground, our correspondent, Stephen Enoch, is in Reno local government area at the moment. Good morning, Stephen.
All right, Stephen, let's start with the situation on ground. What is it looking like and how serious is the situation in Reno right now?
So currently, I'm in Reno local government area. A few moments ago, I was at the hospital, and at the hospital, they told me that they have not had, cases of much cases of diphtheria. And I'm wondering, okay, so why will the lawmakers say they have so many issues of the diphtheria? So I went outside the hospital. I spoke with some people who confirmed to me that yes, they had issues of diphtheria, and currently, people have died of that particular disease. And I'm standing just in a few meters away from me. It's the shop of a local, medicine man. And what they do here is that when they have this diphtheria, there's a thick substance behind the tongue that surfaces. So what happens is some of them don't go to the hospital. They go to the local traditional medicine doctor, and he uses a blade or something to cut off that substance, and these people go back to the community, and before you know, they mingle with children, and those children contact this disease, because cutting it off doesn't mean that the person has been free from the disease. I'm speaking. There's someone who speaks with me now who has someone that had contacted the disease and also taken the person to the local doctor. Now, so wannan cuta ina ta damu ko ana kuma ya kuna shiga wajen gargajiya da ana tura ana cire wannan abun.
Akwai wani bufulatani makocinmu na je sai yake cewa akwai yaransa da yake yin irin wannan cuta, shine nake ba shi shawara. Akwai makocinmu anan ana kawo masa wanda suke irin wannan cuta, yana sa magani yana cire musu a gargajiyance. To da na gaya masa dai, amma shi bai zo ba, amma akwai wanda suna yawan zuwa gurinsa su zo ya cire musu. Yanzu ma dai bai fito ba, sai dai idan kuna da buƙatar ganinsa ko kiransa ne ko kuma ko wani lokaci kuna dawowa sai a ga ya masa bayani. Mu ne Alhaji Alhassan Jangaru.
To kamar mutane kamar nawa ka san sun rasu saboda wannan cutar?
Akwai mutane da yawa wanda suna rasuwa wanda kwanansu ya ƙare. Kamar mutane kamar 10 haka ko sama ma dai wanda lokacinsa yana zama sanadin ajalinsa.
Na gode. All right. So he said that he confirmed that the person, the traditional doctor who removes that substance is just here, and if you can wait, we would see him. So he also made mention of the fact that he confirmed that he has, he know of people that are around 10 and above the figure 10 and above people who have died due to this diphtheria outbreak, and it's something that is very worrisome. Although the Kano State Center for Disease Control said that they have recorded only 32 cases of diphtheria in this local government, but it appears that it is more than that. I'm going to speak with someone else who will tell me how it is a burden to them. His name is Aliyu Saleh. So Gyamana, ya wannan abin yana baku wahala a nan Rano.
Gaskiya wannan abu yana matuƙar yana wahalar da jama'a sosai fiye da baka tunani. Sakamakon daga lokacin da abu ya samu mutum irin wannan lamari har mutuwa ma ana yi. Saboda dalili na farko dai kaga duk lokacin da aka ji ya samu mutum irin wannan abu bai iya cin abinci. Bai iya shan ruwa sannan kuma zai ga cikin damuwa fiye da baka tunani ƙarshe ma ina iya ɗaukar mutum.
I got to say. So he said the same thing, that people die of this particular issue, and he made mention of the fact that some people, when they have it, they will stay in the house, they cannot eat. So if someone cannot eat and the person is still in the house, how can a person be cured of this? And while I was in the hospital, someone told me that, some of them prefer to go to the local traditional medicine doctor, or whatever they call them, because they feel they can, get healthcare easier there, faster, cheaper, because when they receive any of this distress call at the hospital, they refer them to Aminu Kano Teaching Hospital in Kano State, or the IDH, that is the Infectious Disease Hospital in Kano State, and it's a very, very, very long distance from here. So most of them prefer to use the local doctors, and it is, killing most of them here. That is what I have for you at this moment.
All right, Stephen, let's quickly also talk about the reported deaths, because we've been hearing that there are at least 50 deaths that have been tied to this outbreak, and they happen to be children. Have you been able to independently establish the scale of the deaths and the number of the people currently hospitalized? Because it's quite interesting for you to be hearing that it's just about 30 cases of diphtheria that they have identified so far.
Okay, so here in the north and in Islam, if someone dies, the person is buried immediately. So at the hospital, they don't have that statistics. So at the IDH, which houses the Kano Center for Disease Control, they don't have that statistics, but the lawmaker said over 50 have died here. And when I spoke with my respondent, he said that he knows about 10 or above who have died from this particular disease. So from here, we are going into the community, into the hinterlands, to hear from the locals, those who have died. And someone here spoke to me about his neighbor's child who died of the disease. But we are still in the town in Rano. We'll go to the villages where this thing happened, and if possible, go to the grave sites of the people who have died as a result of this particular disease. So it's something that we are going to go in there and verify. The hospital, that is Rano's General Hospital, is not far from here. It's just a few, about 1 kilometer from here. So we'll go to the community and find the real information and to know the amount of people who have died as a result of this particular disease.
All right. What is the response from health authorities so far? Because you did say that, some of them go as far as cutting off the disease from the tongues. Are the affected communities receiving medical attention and emergency support that they need?
All right, so according to the DG of the Kano State Center for Disease Control, that is the issue they are facing, because most of the people who died as a result of this do not report, which means they need to be, a heightened level of education on this, because some of them, when their child, is passing through this, they'll take them to Gargaji, that is a local doctor, he removes it. After a while, maybe the person spreads across different children, or the person later dies. Okay, they'll say maybe it's something that comes from God, and then they bury the person. It's something that's very disturbing, and I know the ministry is doing their best to ensure that the people report these cases, because sometimes if you're not literate enough to understand this disease and to report it, then these deaths will keep on happening. But I believe that people need to be, educated properly on this disease, so that they will, prevent this number of deaths that's happening, because the deaths that are happening are unreported or underreported, because the ministry don't have this figure. It's just from the streets, a neighbor, person, son dies, this person dies, that person dies, no record to show that someone has died, but they are sure of this number, and we're good to ascertain the facts of the situation.
Stephen, we want to thank you for the updates, and we hope that this situation can be handled as quickly as possible and can be ameliorated as well. Thank you.
And just for us to remember, I've never heard what he said before, that they would go and cut off the thick substance.
Yep.
And then go home. And just for those who may have forgotten, diphtheria is a serious and contagious bacterial infection that, of course, leads to a number of other things. It's primarily affecting the nose, throat, and sometimes the skin. It spreads easily through respiratory droplets from coughing or sneezing, direct contact with infected wounds, or handling contaminated items like toys or tissues. The early signs are mild fever, sore throats, fatigue, and swollen neck glands. Then within 2 or 3 days, dead tissue forms a thick gray or white coating in the throat or nose. And that causes difficulty breathing and swallowing. And that's what they're cutting off, and then they go thinking that's it. It is a completely vaccine-preventable disease. Let me say that again. It is a completely vaccine-preventable disease. And it's just sad that the CDC in the States is not able to keep up, because people are, it is a Muslim population burying children immediately, or at least within a day after they die. And so the numbers are not adding up to what the people are saying.
I don't know, the healthcare system, they need to do better. That's why we keep talking about primary healthcare system. If their primary healthcare system is very functional, at least they'll be able to have, you know, a first contact with their primary health care. Nothing happens there.
Everywhere. Maybe Lagos is different because it is Lagos, but other parts of the country, the healthcare, even when I was serving in Bauchi that year, the primary healthcare was just there. Primary healthcare. And you know how it is at local government levels. People just like to come to work and buy groundnut and gossip and then at the end of the day they just go. And they're so quick to usher you or refer you to the main hospital that's in...
Because if the primary health care center is really working, even their local medicine men would have some kind of synergy and integrated, so that even if they have to train, you know, just something thinking out of the box.
That's actually really difficult, because most of them do not even believe in modern medicine at all. You know, they'd rather go to the gargajia people, just like he said. You know, they believe in them more. And then you have people who come up with the idea that if you take, the more you take modern medicine, you know, the lesser your population, you won't be able to give birth. There are chemicals, you know, so when you take it, the idea is to, you know, reduce the population of, you know, the northerners. That's the mentality that they have.
And it's a mentality we should challenge, because in 2026, having diphtheria, hearing people say that over 50 children have died, is not something we should be hearing as a country that claims to be a country or a nation, or to be claiming that we are doing what we're supposed to be doing. Was that not the issue with wild polio, up to the point where we were able to eradicate? So there has to be more education, because it is seasonal. We do it with diphtheria. What's the other one with the rats? There's rotavirus, there's Lassa. It is seasonal. So we need to change. As long as the population continues to have this thought, we need to change how we engage the population.
Okay. If you listen to the symptoms, you know, talked about fever and everything, you know, for them that are not literate, right? The first thing they think is, oh, it's malaria. So they go, they get, just like a go that they have. Yes, they go there. And then if anything happens, just like you said, na Allah ne.
It's God's will.
It's God's will. Let them go. And most of them don't even know that they have diphtheria or anything, because hygiene also is a problem.
Yeah, but when
right?
Environment.
When you go to have antenatal, when you're pregnant and postnatal,
do they even go?
She just answered you. Do they
go? Many of them refer. That is why I believe that we need to, our healthcare system, especially in some northern states, they need to work hand in hand with these Gargajia people. If they know that they trust them, they can train some of them, maybe educate them more on vaccines. If it is their Gargajia that is telling them that this is good for you, maybe they will take it, and that will prevent their lives. Because we need to, if something is not working this way, you need to find creative ways to be able to reach. It's just like going to a household that are only women that are covered, and you are sending men to go and give them vaccination. You know it's not going to work. But you cannot say, oh, because the people are uneducated, they don't agree, you're just going to leave them. And you know this thing is contagious and it's preventable.
It's very preventable. At birth, you know, there's, when we're doing, you know, we that have kids, sorry, Dash.
I have kids. I have 7.
Okay, yes,
Thank you.
So there's MMRs, there's the polio, there's the
so
HPV,
many.
there's even
Everything.
diphtheria. Diphtheria is not even a vaccine that it's just there. It's a
just
drop
droplet,
and that's it. From when they are different milestones.
Yeah.
0 to 3 months, 6 months. There's a whole chart of it. There's the MMRs, then there's the booster shots, there's the...
They need
But
education.
let's
More
not forget-
advocacy groups should come out in the north. Maybe if they know, if there's a little bit of education among advocacy group and they see how dangerous these things are, maybe there will be more awareness about it.
But can you compare to, when, for example, a community imam comes out to say no? They listen to the imam.
Yes.
Exactly.
Right?
So it feels like,
They
let's
need
not
to
forget that
engage.
this is a population that does have a history with vaccines. We can't forget Pfizer. New Century even did a documentary about how many years later and the victims of the Pfizer trials and things like that. So it's a population that has vaccine hesitancy. And it's deeply ingrained and inbred there. So it is a rethink of how we engage. You need to talk to the imams. You need to educate them. You need to strengthen them. There's so many ways and so many conversations off of this that continue. But we have a guest standing by. Catherine.
Yep, we have a guest. So coming up on Jasiri, the debate may have started with what one trainee called Tony Elumelu, but it has quickly become a much bigger thing than a name. From first-name culture and questioning bosses to flexible work, job hopping, mental health boundaries and demands for transparency. Gen Z is challenging some of the workplace rules previous generations took for granted. And therefore, Abibat Sunbola, she is an HR professional and career coach. She is who joins us to look at what the issues could be. Let's talk culture, respect and the changing workplace after the break. Stay with us.
Welcome back. A simple greeting has become one of the most talked about workplace moments in recent days. During an interaction with graduate trainees, a young employee addressed UBA Group Chairman Tony Elumelu as Tony. His correction was immediate. He made it clear that he preferred Mr. Elumelu, TOE, his initials, or chairman, and said he did not subscribe to what he described as Oyinbo life. For some people, his point was obvious. Respect matters, especially in an African context, where age, achievement, and seniority have traditionally shaped how we address one another. For others, the trainee was simply behaving like a young professional shaped by a very different workplace culture, one where first names, accessibility, and flatter hierarchies are increasingly encouraged. And that takes us beyond one employee and one chairman. Are we witnessing a clash between Gen Z and the workplace generations before them? Joining us is HR professional and career coach Abibat Sunbola. Abibat, welcome to Jasiri. Thank you for joining us.
Good morning.
Good morning.
Morning.
All right. I'm sure it was, everybody saw it. We watched the exchange.
The good morning heard round the world.
The good morning was loud and the correction was louder. But beyond whether the trainee should have called him Tony, what did that moment tell you about, the changing relationship between younger employees and authority, especially in the workplace?
Okay, the workplace is evolving, right? And most organizations, especially the global organizations, would address one another by the first name, right? The first name policy still exists. However, the rules are there, right, to tell you these are the guiding principle. But the context will tell you when and how to apply that. Respect is beyond title, right? Even though some people prefer to be addressed by title, but respect is beyond that. It's in how you approach people, how you speak to people, how you have conversations with people, do you listen to people? So all of those encompasses respect. So it's beyond the title. And the workplace, as it's evolving, you also need to understand your local nuance, right? What's the local context? In what culture are you operating in? Is it a very hierarchical system? Right? From the clip, what I see is probably the first name basis is what is existing in the organization. And they probably had a long week of onboarding activities where HR would have said, we all address one another by first name. However, the setting is quite different. You're in a room where you have other graduate trainees and you have the founder. You would have to look at that rule and say, is this applicable in this context? Is it applicable in this setting? And then you can adjust immediately. That's actually emotional maturity, right? Taking the rule and not taking it hook, line, and sinker and saying, what do I need to do? What is obtainable in this environment?
Now, you talk about hierarchy, and we know that older generations often associate, professionalism with hierarchy, titles, deference, and knowing where the boundaries are. And we know that Gen Z are more tilted towards accessibility, openness, equality in communication and all that. But then, can both of them coexist? Can both definition of professionalism coexist?
Definitely. So respect, openness, flexibility, they are not opposites of one another. They actually should work together. It's supposed to be a balance, right? I mentioned that FITU is one aspect out of respect. So the fact that in the workplace we address one another by first name doesn't take away the fact that the way we speak to one another, the way we address one another, we wouldn't apply respect in that instance. From my understanding, sometimes the intent and impact are not the same thing. So your intention might actually be pure. It might actually be true to say, oh, I just want to ask a question. I'm not being disrespectful, sir. But the impact of that to the person listening to you is quite different. I would like to also reference the fact that we've talked about the fact that policies exist because it's a guiding principle. I know one of the places where I'd worked before, there was a policy around bereavement policy. So if you lose someone close to you, it was around 5 days you go on the bereavement policy. But there was someone that just lost his wife and has 2 young children. We didn't need that policy to tell us.
Yes, that 5 days was not going to be
not sufficient.
Yeah.
So you have to understand the context. You can't take it and say, oh, this is the policy, and don't know when and how to apply it. And it doesn't take away the fact that the policy is just it's not a tick the box thing. It's the fact that you need to place the context in the picture and see, how can I apply this?
Wow.
All right, so let me ask you a straightforward question. I'm going to try and merge 2 questions in one. Do you think older managers sometimes interpret confidence or informality or questioning as disrespect just because Gen Zs have a way of asking their questions or doing their things differently? That's one. And then let's flip that as well. Do you think Gen Zs sometimes make mistakes, less formal, make the mistake of looking at a workplace as less formal, maybe in the way they dress, in the way they express themselves, without hierarchy or boundaries? And is there still a need for young professionals to learn to read the room? Because they feel like most of the time, young professionals just go with the flow. And they believe, because that's the dispensation, the atmosphere of today's dispensation.
Yeah, so if I want to address the first question, because of the fact that there's this conversation around Gen Z, workplace, all of that, right? I think older people are beginning to sort of see this place is an hierarchical system, is an hierarchical place. I need to be in that authority level, and I don't want people to talk to me anyhow, because I don't want people to think that because we are reporting to one another or because we are colleagues, you think you can talk to me anyhow. Yeah. So it seems like the older people are getting defensive, which is not the case. I feel like it's just setting some professional boundaries to say that because we work with one another, it doesn't mean that you should disrespect me. I've worked mostly in global organizations. I've not seen a situation where people start saying, "Oh, I'm not your mate," or "I'm not your." I've not had that experience before. I've not had that experience before, and it doesn't take away the fact that happens anyway.
Yes.
Right? Yes. But it's just the fact that you understand what is obtainable now. You understand that it's like the Gen Z world now. So you also have to move with that dynamics as an older person to be able to set professional boundaries as soon as possible, whether you have a Gen Z in your team or not. It doesn't take away the fact that we can work together cordially, but please, these are the boundaries. And even the Gen Z also want some boundaries. Nobody wants anybody to speak to them anyhow, irrespective of the age, right? The second bit to it around, I'm sorry.
Maybe Gen Zs now mistake a less formal workplace for one without hierarchy or boundaries.
Yeah, so, as you grow older, right, maturity lets you define what it is, right? So people can mistakenly say, oh, because it's a Gen Z era, I want to be able to speak to anybody where I want to be able to speak to anybody. But from your experience, as you continue to grow in that organization, you begin to understand, because you start feeling like an outlier, because everybody adjusts and you're just the only one in your own bubble doing your own thing. So I feel HR has a critical role to play in all of these things. There are a lot of conversations around generational dynamics, how you relate and all of that. But I think we need to do more. So if you look at the case, right, HR probably would have said, we address one another first name. But I'm sure HR also know that the chairman doesn't want to be addressed by first name. So when I'm not there, I don't know what could have happened, but I felt like there should be an emphasis to say, even though we address one another by first name, but there's an exception, which is the chairman. You don't address the chairman that way. So I feel like HR has a very critical role to play in all of those conversations.
All right. Well, this conversation does not stop at titles, because Gen Z is also questioning long hours, rigid office structures, silent obedience, staying in one company for decades, and even the idea that the boss should never be challenged. Are they entitled, or are they forcing workplaces to confront practices that should have changed a long time ago? That's where we go next, after the break.
Thank you for staying with us here on Jasiri. If you listen to some employers, Gen Z is difficult to manage. Punto. End of discussion. Because they want flexibility. They ask why. They talk openly about salaries. They prioritize mental well-being. They challenge managers. They leave jobs quickly when they are unhappy. And many are far less willing than previous generations to accept because I said so as an answer. But Gen Z would probably tell you something very different. They might say they simply refuse to normalize toxic workplaces, unreasonable expectations, and hierarchies that demand obedience without accountability. So perhaps the real conversation is not whether Gen Z can survive the workplace. It's whether the workplace can remain unchanged as Gen Z takes over more of it. Our guest, Abibat Sunbola, HR professional, career coach, is still with us. Abibat, so we went to the streets to see what Nigerians thought about the situation that happened. This is Jasiri on the streets, guys.
She was disrespectful. As she said, Mr. Tony Elumelu to have been okay, but Mr. Tony is disrespectful.
We are all Africans, then we're taught to respect our elders. So you calling a grown man by his first name doesn't make any sense.
My boss is my boss. I have to respect my boss because he's my boss. So whatever he says I should call him, I'll call him. As long as he's my boss, so I have to respect him because that is the law of God. So we should respect the authority. So whatever he says I should call him, I will call him.
It depends. If my boss says call me by my first name, I'll do it. I'll do it.
I won't do it. Yes. I still won't do it. Because I'm an African man, I was taught to respect my elders, so I will not do it.
Respect is more of how you treat the person, not by the titles that you attach to talking to the person. It's not about calling them madam or sir. It's about how you are treating the person. That's respect. But I would still say the same thing, right? Generation Z is different from millennials.
Yeah, I think they are taking the white culture. Because, you see, where I'm going to put this blame on is from our parents for taking the white culture. They were the one that started it. Then the new Gen Zs too are taking that culture and they are taking it too far. To the extent they are disrespecting their elders, calling them by first name. So,
unlike before, who are we to not greet our elders? Now they will just walk past like without seeing you.
I don't think it's either rejecting a culture or I just think it's trying to create a different type of culture that is merging both influences together.
I don't feel like young Nigerians are disrespectful. If you want to be disrespectful, it's on your own part. It's on your own part. Maybe your moral upbringing. Someone like me would definitely never say Tony. I would say Mr. Tony, not Tony. So I feel like it's on her part. Yes, she was disrespectful.
Most especially age. People say age is just a number. Age is not just a number. Age is something that is not easy to be at that age. If I see a 50-year-old man today, even though he doesn't have money, I still have to respect that person.
Money has a way of blinding. Money has a way of blinding you. You don't even know when you start to call the person sour or mad just because you want to get something from them, right? So I really don't know, but I know that if I ask him money.
No, respect is reciprocal, like I would say. So it's just simple courtesy. Simple courtesy, and we are in an African culture which demands that you respect your elders. Then also simple courtesy. Mr. Tony, there's no big deal about that.
You see, it depends on the age. If, for example, now the CEO is my friend, I can still call him by name and still respect him. With the tone I talk to him, with the way I interact with him, you will know that, oh, they are like boss and like his worker, so there will still be respect.
Of course, I can still call my CEO. It depends on age, actually. Do you get? It depends on the age. Calling my CEO by first name, of course, the respect will still be there.
Very interesting. At least I love the fact that when we went on the street, we talked to a lot of young people, and you can see how everyone seems to, you know, say the same thing in different ways. Anyway, back to our question, and thank you very much, Abibat, for being with us on the show still. These Gen Z, sometimes they are described as, I would even say, I personally describe them as entitled, impatient, and overly sensitive. And sometimes they're unwilling to pay their dues. I was a lawyer, and I know what they say about paying your dues. It was a heavy load, and we had to pay it. You know, is that criticism fair? Or are some younger workers simply less, you know, willing to tolerate unhealthy workplace culture? It's just like when I was practicing, there were many rigorous things I went through. And they would tell you that as a lawyer in practice, in training, you have to pay your dues. That the generations before you did that, you have to do it too. I would carry a big bag from the island to the mainland, and they will give you tea fare. Imagine in the bus with your wig and gown in a bag and your books in another and the case file. And when they come back, they will still ask you for change. And they will tell you that we all went through that hardship. Exactly. So are these Gen Zs just saying, no, I'm not taking this nonsense that has been happening over the time? Is that what their stand is?
So I think there's a narrative that is circulating that makes it look like anything you want to get, you can achieve it now. I think we need to start from correcting that narrative. There's something called delayed gratification. A number of us,
they don't know that.
A number of us are here not because we didn't work hard for it. We knew that we did. Some of us didn't even start as a newscaster. For me, I didn't even start as human resources professional. I probably started as a front desk. So you can imagine that I knew where I was going. I knew what I wanted, but I didn't say, oh, I want to be HR, so they didn't offer me this position, I'm going to leave this place. I worked for it. There were times where I would go and understudy, go and job shadow, just to understand the job, so that I can, because I knew where I was heading, I knew where I was going to. So there's this thing we need to teach Gen Z, which is also around patience, right? So it's beyond respect, even being patient to understand that some things will not come to you easily.
Immediately. So
that when it comes to you, appreciate it and treat it the way it should be treated. And in the workplace, you would see that dynamics. There are impatience. I know there are times I would close late, not because I wanted to, but the situation demanded for it. My boss was still in the office. Nobody wrote it on the blueprint, oh, you have to close late. But I just felt it was weird. I was supporting my boss, and he's still in the office at this time. I would also close late at that time.
No,
I see that.
Carry bag and tell you, say it tomorrow.
Sometimes you're in a meeting and they're saying, oh, I have a taxi to I have to go now. I have to go now. So what happens to the work?
They'll tell you, this is the amount, this is the time I signed, 9 to 5.
I can't do a minute more on it.
Yeah, except you are paying me for overtime, and it wasn't in my contract.
And I'm more concerned because we now have the other generation, which generation Alpha, because then my son is saying, oh, I'm generation Alpha. They're coming into the workplace now. So how do you want them to be resilient? What are you training? I think for us, most of us, we are passing down that, oh, do it this way. This was how the workplace was. But I feel like that is changing. And I'm even more worried about 5, 10, 15 years down the line when we have the Alpha in the system. What's going to happen?
Don't forget job hopping. Gen Z is now most younger professionals. They leave quickly if the salary, if the growth, flexibility, culture, if these things don't work for them, they're out the door. So let's talk about workplace loyalty. Do you think that has changed? Is changing? And should employers be constantly worried about that?
Significantly is changing. Right, the fact that you're looking at the resume and you can see 3 months, 4 months, and I'm wondering, what did you learn within the space of 4 months? 4 months, you're just settling into the role.
Yes.
So you're moving here and there, and you're wondering, okay, so what specific skill do you pick up in this place? What specific skill did you pick up here? It's hard to even combine all of the places you work to say, oh, this is the professional that you are.
Yes, that's the
right. So I feel like in fact, most of them don't look at an organization and see the bigger picture anymore, or look at it in the long term. They look at it's when I'm highly favored or when this is working for me, it's not working for me.
I leave.
Whilst you have your choice, your personal choice, say, this is what I want to become. Okay, this is not something. But you also have to learn that when do I stop learning and start exploring? Because I feel like it's a combination of everything. They're learning, they're exploring, they're doing everything at the same time.
But don't you think it's also something they've gotten from their parents as well? Because let's be honest, parents have gone home and complained about these same things. About the burnout, about work-life balance. Maybe we didn't have a term for it then, mental health. What do you have mental health days? But now we have terminology. So it's almost like they're able to put words to what they saw their parents, what they saw other people around them experience. They won't experience it the same. So because I'm thinking back, I have conducted interviews. I tell them, I've conducted interviews and my eyes have seen wing from Gen Z. And it's not to say, I look at some of their demands, or let me not even say demands, some of their expectations, and I think, wow, why didn't I have this expectation when I was coming up? So I think there's a balance to it. I'm definitely not one to completely give them a free kidney, but don't you think that some of it is good to challenge how workplaces were before and change them? Because employers are talking about loyalty. What are you doing to deserve loyalty? When we flip it back, what are employers doing to deserve loyalty? And it's not just toxic workplaces that people leave. People leave managers. So people leave places that don't allow them to grow, have a trajectory. I know that, see, if I see somebody who has 3-4 months here, there, bed hopping, a big job hopping, whatever you want to call it, I'm going to be very, very, very picky about, am I sure I can trust you to come in and stay and grow?
Exactly.
Yes. Exactly. But also, are employers changing enough for them to also demand or continue to expect the loyalty of past generations? The truth is, I think most employers are changing.
Oh,
yeah. The policies are actually changing. In the past, there wasn't really first name. An example is this: the first name basis sprang from nowhere, and most organizations.
But is first name better salary? Is first name a better workplace? Does it translate?
Yeah. So whilst I can't speak for the individual employers, but I understand the fact that there needs to be a balance. Okay. Right. They are also very outspoken. Oh, this is not. I don't want this. I don't want that. At the same time, you also have to take a step back and look at it. That am I demanding too much of my employer as well? What am I also offering back? Right. I feel like if you're offering value to your employer, there are some conversations that you shouldn't even have. Salary increases will be a given, for instance. So I feel like before you even make some demand, you see someone making demand for salary increase, but you're asking what value. I've seen some funny memes on the internet for when someone will say, oh, I'm tired of this work, and the person then goes and say, oh, I want to resign, and then someone else goes and say, oh, I want to resign, but like, please don't resign, please don't. So you also have to be in the place of giving value. Don't always look out for yourself alone. Generally, whether Gen Z, whether millennial, whoever, just make sure you're not selfish about what you want to achieve. You also have to think about the other person. This person has employed, this person is paying most people's salary, everyone's salary. You also have to be able to give back something, value.
Okay, so let's look at this. If you were advising a young professional watching this conversation today, in light of everything that has happened, what are workplace behaviors that should never be dismissed as old-fashioned? What still matters, regardless of generation? Because I'll add to it, because older generations, people were looking at professional discipline, punctuality. It's like these people do not own a clock. Some of them, I'm sorry, dress. He's like, we did not teach them that there's a place to dress a certain way at a certain time. Formal communication, I've seen. Patience, all of that. So what are some of the things that you shouldn't just throw away as old-fashioned if you're a young person in today's corporate environment?
I think I will take you from the angle of policy. First of all, don't throw away the organization's policy as old-fashioned, because each organization has different unique policies. So you can't say, oh, this is what somebody told me that they do in their organization, and you bring that same thing to another organization. It's amazing, because in another organization, they do this, they close before 5 p.m., for instance, they get to work 9 a.m., for instance. Doesn't mean that you should bring exactly the same thing and copy and paste it in your own organization. So you have to understand that what is the organization binding, or what is the policy binding this organization, first of all? And then now you then look at how you then apply it. What are the context? What are things I'm supposed to say? What are things I'm not supposed to say? All of those things in terms of dress code policy. What is the dress code policy of this organization? What are the things I'm supposed to wear? Even if the dress code policy on a Friday, for instance, says dress down, and you know you're going for a client's meeting, would you still dress down? Those are the things that you need to always think about.
I know how much Tolu has struggled with this dress code thing. And sometimes what I see, I'm like, oh my goodness, what is this? But then
she's always saying,
always.
I couldn't trust me.
Before I end up on social media, very quickly, dashing on the other side of this.
Okay, now on the other side of this, you know, if you were advising senior executives, what attitudes towards younger employees actually need to change from them?
Just 30 seconds.
I think it's a bit of patience, right? The world of work is really evolving, and we can't. It's moving so fast. We can't change that fact. So you need to first of all understand the number of what type of generation do I have in my system, and then it won't be one size fits all. What is very okay for a millennial might not be okay for a Gen Z. So you need to understand and be a bit patient and ensure that the rules are there, the policies are there, and you follow that strictly. Else, the workplace can really turn to something else that you didn't envisage.
Absolutely. Wow. Thank you very much, Abibat, for joining us today. Very interesting. A conversation that has begun, that began with Good Morning, Tony, has now revealed something much bigger than a debate over titles. The workplace is changing. A generation raised to question, speak up, prioritize, boundaries that, they expect access to leadership is entering institutions that was often built on hierarchy, seniority, and deference. And neither side can simply pretend that the other side does not exist. Gen Z will still need professionalism, emotional intelligence, and an understanding that every workplace has boundaries. But organizations and their leaders may also have to accept that respect is evolving, and that being challenged is not always the same thing as being disrespectful. Perhaps the real test of the modern workplace is not whether everyone calls the chairman by the right title. It is whether people at the very level can disagree, learn, correct, lead, and be led without being mutual, with mutual respect on both sides. And that is our show today. We'll be back again tomorrow by 10 a.m. So, bye for now. Bye.